Okay, we're going to talk, if your patient has trauma to their ankle, we've got to check it for growth and stability. It's one of those things. And some stability tests we're going to do are medial and lateral stability. Medial stability, of course, is supported, your medial side of your ankle is supported by the deltoid ligament. And so what we're going to do is we're going to take our patient's ankle, and I'm going to put some stability right through the lateral malleolus over to the medial malleolus. I'm going to grab down more on the hind foot here, right around the calcaneus and the talus, and I'm just going to pull laterally. Pull it laterally, just like this is how I'm pulling it. And we're checking for stability on the medial side. If we have any signs of laxity, that could mean we have some damage to the deltoid ligament. We're going to do the same thing for lateral stability. This time I'm going to stabilize by reaching across onto the medial malleolus. I'm going to put the heel of my hand over that hind foot, over the talus and the calcaneus, and I'm going to push it medially now. And we're checking lateral stability, and that would be primarily your anterior talofibular ligament, but there's other ones that get the talocalcaneal, posterior talofibular. A bunch of them could be involved. So again, we're looking for stability there. And a couple other tests for the anterior and posterior talofibular ligament. We're going to do the drawer test of the ankle. And so what I'm going to do, I'm going to reach behind the patient like this, and I'm going to stabilize as much as I can into the distal tib fib, and I'm going to push the talus backwards, right underneath, and I'm going to draw the distal tibia and fibula forward. And as I'm doing this, if there's any type of translation here, that's a damage to the posterior talofibular ligament. I can switch these around here, and now I'm going to pull the talus forward this way, pushing the tibia and fibula backwards. And if the talus translates forward, that's an anterior talofibular ligament damage. I'm going to have a patient lay prone, and sometimes people damage their Achilles tendon, and of course the Achilles tendon is connected up here into the gastroc, etc., and it's for plantar flexion. So we're going to bring that patient's leg up like this, and we're just going to have them be totally relaxed, and we're going to just come up on the distal part of the gastrocnemius, and we're going to just compress it this way. And we can see the foot moves into that plantar flexion. That lets us know that the Achilles tendon is intact. And that's called Thompson-Simmons test.